Hey there, welcome back to How to Medicate, and today we will be discussing more than an individual's relationship with food. As the title and the thumbnail suggest, we will be discussing eating disorders. I will cover all the ins and outs, what exactly is an eating disorder, what types are there, we will cover some tips and tricks, and ultimately I will present you with a possible treatment plan. So make sure to watch the whole video so you don't miss any valuable information. For those of you I'm meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewer, because educated people make healthier decisions, which is the whole point of this channel and this entire video. This video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice, and when looking for medical advice, you know it, just contact your personal doctor. And now let's get learning. And as promised, I will start by explaining exactly what eating disorders are and what types exist. And when Googling it, you find the following definition. Eating disorders are serious conditions related to persistent eating behavior that negatively impacts your health, your emotions, and your ability to function in important areas of life. And the DSM-5, the most used diagnostic manual for mental health disorders, characterizes 9 different types of eating disorders. Most well known are Anorexia Nervosa, Bulimia nervosa, pica, and the binge eating disorders. And in this video we will focus and we will zoom in on these last 4. In Anorexia Nervosa, also called anorexia, patients restrict their food or calorie intake to levels below their minimum required calorie intake. People with anorexia do this by limiting their calorie intake, the amount of food they eat, by excessively sporting, by using laxatives, or by vomiting after eating. Through these techniques, people with anorexia rigorously control their weight and their shape. As you might know, this can lead to a significantly low body weight in relation to a person's sex, age and build. In extreme cases, causing a BMI below 15, where a healthy BMI would be between 18.5 and 24.9. Patients may also experience a disturbed body image and may have an intense fear of becoming fat or gaining weight. Taken together, anorexia interferes with all aspects of a person's life, ultimately causing serious health consequences or even leading to self-starvation. Which brings us to bulimia nervosa, also called bulimia. People with bulimia may experience episodes of binging and purging. During these episodes, a person may typically consume a large amount of food in a short time. This is called binging. In people with bulimia, this may cause an intense fear of gaining weight or feelings of shame or guilt. Therefore, they may try to compensate for the binging in an unhealthy way. This is called the purging, which people with bulimia may do by limiting their calorie intake the rest of the day, by excessive sporting, vomiting after eating or binging, and lastly by using laxatives. In addition, people with bulimia may experience a lack of control over their eating and over their binging, and they may be obsessed with their body weight and body image and may judge themselves harshly for self-perceived flaws. Now you might think there are a lot of similarities between anorexia nervosa and bulimia nervosa, which is true, as bulimia too may cause serious health consequences along the way. However, one of the biggest differences is that people suffering from bulimia nervosa have a normal to high body weight and a normal to high BMI. Next up, we will be discussing binge eating disorder. People with binge eating disorder feel a lack of control over their eating, and they may experience weekly episodes of binge eating. In mild cases, this is 1 to 3 times a week, but in extreme cases, this can be more than 14 times a week. During or after such an episode, someone may eat while he or she does not feel hungry, may eat more rapidly than normal, may feel uncomfortably full, may eat alone because he or she is embarrassed by the binging, and lastly may experience feelings of guilt and shame. An important difference between binge eating and anorexia or bulimia is that people with a binge eating disorder do not compensate for their binging. In addition, people with a binge eating disorder may have a normal weight, may be overweight or obese. Which brings us to another eating disorder mentioned in the DSM-5, pica. People with pica persistently eat non-nutritive and non-food substances over a period of at least a month. And this eating behavior must not be a part of a person's cultural practices. Pica may lead to intoxications, nutritional deficiencies, or obstructions of your intestines, which can cause serious health problems, which even might require surgery. Now you might wonder, how are these eating disorders caused? And unfortunately, the precise mechanism is unknown. However, it is found that certain biological and genetic factors play an important role. In addition, there's also a strong link with some mental health disorders, a low self-esteem, perfectionism, impulsive behavior, and troubled relationships. There are also several risk factors which makes a person more likely to develop an eating disorder. Important risk factors are being female, being younger than 30 years old, having a family history of eating disorders, having another mental health disorder, dieting, and experiencing excessive stress. Which brings us to the treatment of eating disorders. And here it is important to mention that overcoming an eating disorder by yourself can be very hard. So if you experience any of the previously mentioned symptoms, or if you think you're having an eating disorder, always discuss this with your personal doctor. He or she might be able to help you. Your doctor could do this by help you to find out the extent of your symptoms. Your doctor might explore any underlying causes, provide you with tips and tricks, and if needed, set up a treatment plan. Your doctor might do this by asking about your medical history, your current symptoms, the medication you're using, and afterwards your doctor might do a physical examination, a psychological examination, and some blood tests to rule out any other underlying causes. And if necessary, your doctor will refer you to a dietist or a mental health professional, as starting treatment early could prevent your symptoms from worsening. Next up, overcoming an eating disorder can be very tough. Therefore, it is important you stay in the best shape possible. So take good care of yourself. Make sure to have a structured sleeping schedule, sleep at least 7 to 9 hours a day. If possible, eat enough vegetables and vitamins, drink about 2 liters of water each day, try to exercise regularly but not too extensively, and maintain regular contact with your loved ones. And then, if necessary, your doctor will come up with a treatment plan. Treatment is most often followed in team setting, where a team consists out of a primary care provider, a mental health professional, and dietitians. Your treatment plan itself depends on your specific eating disorder and the severity of your symptoms. But generally, it typically includes nutritional education, psychotherapy, and medication. And if your life is at risk or if you experience serious medical complications, your doctor might advise an immediate hospitalization. Which brings us to psychotherapy, also known as talk therapy. This type of therapy can be followed individually or in group setting. In psychotherapy, the underlying psychological problems and the unhealthy eating habits are addressed, with the aim to overcome these and replace these by healthier habits. Psychotherapy usually lasts 6 to 12 weeks, but it can last a lot longer. Depending on your specific eating disorder, there are many types of psychotherapy which could be helpful, but most commonly doctors start cognitive behavioral therapy or family-based therapy. Cognitive behavioral therapy aims to help you manage problems by changing how you think and act. It uses a range of psychological techniques to help you learn healthy new ways to cope with your eating disorder. Family-based therapy is an evidence-based treatment for children and teenagers with eating disorders. In this treatment form, someone's family is involved in creating healthy eating patterns and maintaining a healthy weight. And as already mentioned, psychotherapy is often combined with medication. Medication can be helpful to reduce binging, purging, as well as excessive thoughts on foods or your body image. Depending on your specific eating disorder and your symptoms, your doctor might prescribe antidepressants or anti-anxiety medication. For more information on any of these, check out the playlist in the description after watching this video. Now, I hope you learned something about eating disorders. If you have any questions, let me know in the comment section and I will do my best to answer all of them. Because educated people make healthier decisions, which is the whole point of this video and my entire YouTube channel. If you did learn something, please leave a like. This will help out the channel tremendously, and consider subscribing, as I'm posting weekly awesome videos. I'm trying to reach 100,000 subscribers and you can help me to reach that goal. Thank you all for watching, and especially I want to thank my Patreon supporters. Thank you, Sebastian, who's an investor to your supporter. And for those of you that can't get enough, I'm also posting a few times a week on my Instagram at How to Medicate. I see you there, or otherwise I might see you next week with a new video. Bye bye.